Good day, everyone. My name is Ruth Miller, and I'm a physical therapist and Vice President of Clinical Strategies for Health Pro Heritage. I'm joined today by two therapists, Kelly Simon, occupational therapist, and Kier Gandhi, physical therapist, who are both working on a dedicated COVID-19 unit, and they're here today to share their experiences. We all know that with the COVID-19 pandemic, it has changed how we deliver healthcare and especially therapy services. So Kior and Kelly are here today to share their experiences and their encounters and their practices on their dedicated COVID-19 unit. Hebrew Home at Riverdale recently opened the COVID-19 unit where Kelly and Kior work. And so they'll help us understand some of the challenges and barriers they've gone through to work with their patients. So first of all, I want to thank you both, Kelly and Kior, for joining me today to talk about your experiences. And thank you for the extraordinary work that you do every day working with our patients with COVID-19. So I understand that when your COVID-19 unit opened a few weeks ago, you were the first therapist to volunteer to work on that unit. So what prompted each of you to volunteer to work on the unit?
I thought that working on the COVID recovery unit would be a good learning experience and to help me grow as a clinician. And it's a good way to help out and just do what I can to stop this disease.
And Kior?
Feel that it is a good opportunity to learn new things in this pandemic. It gives us even opportunity to share ideas, share information, and be a voice to other people out there, let them know about the positive things happening here.
And were either of you fearful at all to work on the COVID-19 unit?
I wasn't necessarily fearful. I knew that these patients are on the road to recovery, they're on medications, they're stable, they're getting discharged from the hospital, and that we would have PPE to protect us there.
So I agree that I was a little bit fearful before, because I know that this virus is highly contagious. It spreads easily and so fast with just even contact or droplet. So, but I felt even much more secure when they provided us with the right PPE.
Excellent. And I'm sure the patients appreciate you being on the unit with them.
Yes.
So when you first started seeing patients on the unit, did you see the disabilities and the problems that you expected?
A lot of the patients were just very deconditioned and had poor activity tolerance, which I expected.
And I feel the same. I mean, like most of the people coming here were elderly, above 80, 85. They have very similar conditions and similar impairment showing around.
Okay, and so what kind of treatments have you provided for these patients?
Early mobility is kind of the key for these patients, and just getting them to sit at the edge of the bed. PT's been doing a lot of that.
Mainly, we are working with functional mobility, working on the endurance, strengthening, and even pulmonary rehab in terms of breathing exercises, incentives, spirometer, even positioning at times for some residents.
And then in OT, we've been working on just doing ADLs, energy conservation, med management, talking about home safety and DME, home exercise program, vital sign management, everything like that.
Excellent. And what have been some of the response from the patients while you're working with them?
I think a lot of them are just so grateful and appreciative of little things. Even one of my patients getting her to the bathroom to wash herself standing at the sink, she thanked me for like 3 days after. We communicate a lot with their families and have like FaceTime with families. They're so thankful for that.
Yeah, and I also feel the same. Like initially, the patients, when they got here, they were not aware of all the things, but as they were recovering, they were more alert and oriented. They feel more encouraged to do activities that we were helping them. So I think it was a positive experience for them too.
Great. And tell me, have you been bringing equipment into the rooms, or what have you been using as to help you with your treatments? Any equipment?
I haven't been bringing any equipment besides TheraBand, to give them for home exercise program. And then I think that's it, because mostly I'm just doing ADLs and mobility and just doing functional activities.
Great. And Pierre?
PT point of view, we are like trying to get more TheraBands. We are giving them home exercise program, getting the walker in the room, so at least they can move in the room from bed to bathroom with some supervision by the caregiver. Even having them sit in the wheelchair when we are not, when they're there during the day, apart from the PT.
Good. And are any of your patients or soon ready to be transitioned home or back to the community?
Definitely.
Yep. I mean, we have to have some patients on our caseload. I mean, they are just, I feel they have recovered well. They have, the O2 sats have been better, and we're just waiting for their safety transition to home after they have been tested negative.
That's excellent. And what kind of specific training are you working on with them to help them get ready to transition home?
Mainly working on the home safety assessment, family education. If they have caregiver, we want to educate the caregiver also, and work on the safety with the residents. If they need any DME or any equipment for safe transition to home.
And reviewing kind of like health literacy and disease management, making sure that they could measure their vital signs at home, everything like that, making sure they could do their medication safely.
So how are you communicating with the family with caregiver training or home assessment, or how are you dealing with that?
We have iPads here that we could FaceTime with the patient's family members, and even just giving them some of our patients, their children, call right after the therapy session to let them know how it went, what we did, what we're working on.
And I think we have been like more in touch with the family, with having them call through FaceTime or even just through a regular call, getting to know the prior level of function and updating them about the patient's progress in rehab.
And are you on the unit all day, working with patients all day?
Yes.
Right now, that's my whole schedule is just on the COVID unit.
Okay.
I mean, most of them try to go there during morning, and sometimes we are able to go again in the afternoon. So we feel that we are there most of the time during the day on the unit.
Great. And have you learned anything from this experience?
I've learned it's been such a positive experience, and I actually really like it, seeing the patients get better. There are so many of them so motivated to participate and go home. And it's just been a good experience.
I feel like in this experience with everything going around, I think moving them, getting to move is like more important at this time. Having connect them with the family is more important because most of the patients are isolated or quarantined, so they are not in touch with the family. So it's important to have them touch in family so that they are motivated.
Great. So before we leave, do you guys have any advice to give to other therapists who may be starting to see patients with COVID-19?
I think my advice would just be stay calm. Everything that's out in the news is crazy, and it's scary seeing how it affects the elderly. But once you work with these patients and you see so many of them are recovering and there is a positive to it.
I feel like COVID-19 is going to be putting a lot of impact or strain on the hospitals and the healthcare workers. So I feel like getting patients out of the hospital is important at this time. And who knows, in this time, like during this pandemic, there's a chance to explore the role of PT in a pandemic, right?
Excellent. Well, again, thank you so much for your time today. And again, I want to thank you for your dedication to our professions and your dedication to Hebrew Home at Riverdale, and especially to the patients that you're serving each and every day to help them get better. So thank you very much.
Thank you.
Thank you.